Hey guys, welcome back to the God Medicine Coffee channel. I am Rihanna, and in this video I will be sharing my obstetrics and gynecology experience. Today's scripture of the day is taken from 1 Corinthians 15:58, which says, "Therefore, my beloved brethren, be ye steadfast, unmovable, always abounding in the work of the Lord, for as much as ye know that your labor is not in vain in the Lord." I'm not even going to front with you guys. This coffee is cold, but it tastes really good. So, oh, glorious. All right, I'm good. So, as I said, I just wanted to share with you guys exactly how my obstetrics and gynecology experience went and would I consider Obs&Gyn as a specialty for the future. Who knows? But yeah, I'm reading from my phone just to get my thoughts together. So Obs&Gyn was my first rotation of year 4. It's an 8-week rotation. You know, basically you have your clinic hours to make up, you have a task card to fill out, you have a casebook to do, and then at the end of the rotation you have your multiple choice exam as well as your OSCE, right? So your task card has different procedures on it that you have to either observe, perform, or assist on. So you have procedures for both obstetrics and gynecology separately, right? So with this being my very first rotation, of course, I was hella nervous and very lost because I just did not know what I was doing in the hospital. I did not know where I was supposed to go, who I was supposed to report to. I was like a fish out of water. So, you know, it took me a while to kind of figure out exactly what I was supposed to do. So for me, roughly around week 4, week 5, which is kind of late, is when I kind of got my bearings and I figured out what I was supposed to do, right? But I did start off kind of lost. So don't be like me. So I want to kind of share this video so that you won't be like me, right? I did my obstetrics and gynecology rotation at Port of Spain General Hospital for the 8 weeks, and it was a really good experience. I was surprised that I would like it. I went into this rotation thinking that it was going to be lame, to be quite honest with you. I thought dealing with pregnant ladies, babies, I wasn't particularly excited about that part. But surprisingly enough, obstetrics and gynecology has a lot of medicine in it. Enough to keep your mind going, which I really liked. And of course the surgeries and all that good stuff, right? So when we got there, we kind of had to ask the team that we were on what their week schedule looks like. So that's one thing that you have to do. So you have to find out how often they have call and when they have post call, what days they have clinic, all that good stuff, right? So call and post call is mandatory. You have to go. For our team, at least, it kind of went on kind of rotation. So I think call would be every 5 days or something like that. I can't exactly remember. And of course, post call would be the following day. So, you know, call would land on weekends. So just know that during this rotation, you are going to lose some of your weekends because of what the call would fall on, right? And of course, you have clinic. So my team, we had clinic on Thursdays. How they did clinic is that they would have the obstetrics clinic in the morning and the gynecology clinic in the afternoon, evening time. So we would be in clinic from 8 in the morning till about 4 or 5 in the afternoon. So yeah, and the team that I was on, they don't typically take lunch breaks. So we kind of had to, gather around as a team and kind of give them the puppy dog eyes and hope that they feel sorry for us and dismiss us for lunch. The team that we were on, they don't take a break because they do take on a lot of patients, and when you take breaks, they kind of keep people waiting a lot longer. So they just try to get as much patients done as possible so that they don't keep people waiting longer than they should. So yeah, so that's basically how the whole setup went. And yeah, like I said, I really did not expect to like the rotation that much because it kind of has a lot of medicine in it. As I mentioned before, there's a touch of, microbiology in there, a touch of immunology in there, of course, plenty embryology. Plenty. Embryology will always come back to haunt you. Obstetrics and gynecology, we had 2 OT days. So there was an OT day for obstetric surgeries and an OT day for gynecology surgeries. So during the rotation, we'd get to scrub in on different procedures and stuff like that. And we try as much as possible as a group to kind of spread out the procedure so everybody gets a chance to scrub in. So, like I mentioned in previous videos, try to have like a collaborative, attitude, like work together with your fellow classmates and not work against them. Like you have 8 weeks to fill out your task card, you could get it done. Like it's not impossible, it's not difficult, right? So as much as possible, try to spread out because they're always doing C-sections, they're always doing hysterectomies and all these different things. There's more than enough surgeries that everybody could get their task cards filled out. But yeah, it was a great experience. I don't know how else to describe it. You would meet like people who would be kind of harsh with you because you're a student and stuff like that. You would get that anywhere, any hospital, any team, it happens. You just kind of have to, you just figure out how you're going to deal with that. It's like it happens anywhere. I heard like a lot of people had bad experiences at other hospitals, different teams, but my experience wasn't that bad as theirs. So maybe I might be a little bit biased when it comes to Obs&Gyn, why I like it so much, because I was with a really good team. So grateful for that. We did have to stay back really long hours at the hospital, but luckily for me, my team did a lot of bedside teaching, which kind of made up for being in the hospital that long because, if you get dismissed early, you get to go home and study and make up for where you're lacking. But for us, because we were at the hospital, sometimes on a normal day where we had rounds and ward review, we would be in the hospital till about 8 o'clock at night, from 8 in the morning till 8 in the night. So that's kind of late for us, but at least throughout the day we would get really good, bedside teaching. The teaching was pretty helpful because a lot of the information did come up in the exams, both the written and the OSCE. So I was really thankful for that. The team that I was on was really amazing. I'm really grateful for that. But yeah, I can't remember all the surgeries that I did, but I remember my very first category 4 C-section that I scrubbed in. I can't remember. I know it was the first week at my rotation that I got to scrub in on a C-section, and I think the case specifically, I think a baby had signs of being in distress, so they wanted to do an emergency C-section on the patient. So I remember scrubbing in, and I was just in awe of just how fast it goes. When you do an emergency C-section, it's a real emergency. So you would find that, they're cutting through, the layers of skin and tissue, and they're just going through pull, cut, pull. They're literally ripping because you can't just sit down and cut everything neatly. You have to rip and get in there, yank the baby out. And yeah, so I remember I just remember how fast everything was going. The doctor was just giving me instructions like, hold here, pull this, retract, put this here, and just go, pull, do this. And I was just like, okay, just following instructions. And then when they took the baby out, they told me to hold the baby, and I froze. I got so scared because I'm just looking down at this baby, and I was like, and then the nurse just grabbed the baby and carried it to the station for the pediatrics team to see about the baby and so forth. But I remember when they took the baby out, the baby did look kind of blue. So that was kind of scary. But eventually we heard the baby cry and we're like, yes, praise God. Baby is good. Baby is okay. And, and then, of course, we had to, there was a lot of cleanup to do because as soon as they cut open into the amniotic sac, you just saw all the green stuff come out. So definitely some meconium was passed. Yeah, but all in all, really cool experience. I just remember being in awe of how quick the surgery went and just looking at all the layers when you see the abdominal muscles and everything, and just trying to piece together the anatomy in your mind, looking at the uterus, seeing the ovaries, seeing where the ovaries and the uterine tubes are and everything. Really cool. It's one thing to see the pictures in lectures and another to observe everything in person, right? Seeing the placenta and really cool stuff. Really, really cool. The amount of blood loss is crazy. Yeah. So for obstetric surgeries, you do have to wear boots because of the amount of blood loss, and definitely got some blood on my boots during some C-sections. Yeah, but the boots are really uncomfortable. It's these hard, flat boots, and you're standing in the OT for an hour or more, maybe 2-3 hours, and yeah, it could get kind of uncomfortable. So I could kind of see why some of my classmates were running away from scrubbing in on C-sections, because it's a lot of standing, and those shoes are just really uncomfortable. But all in all, it's just, I don't know, I was just in awe. I don't know if that's something I would get tired of seeing. You hear people talk about the miracle of life and all that drama, but it really was like witnessing a miracle. Even if it's a C-section, it's still miraculous to me to see a baby being born. Like, that's how I see it. And just learning, and always grateful to the surgeons who take time to teach you everything about anatomy. And yes, you will get drafted. They'll ask you about blood supply and the innovation of the different structures and stuff like that, and you may get it right, you may get it wrong, but at the end of the day, you're there to learn, right? Like anybody else. They were students once. They know what it's like, right? So you're not going to get everything right. But yeah, I remember the very first day, actually, I witnessed 2 vaginal deliveries. And I don't know, I felt like I was getting kind of emotional, like seeing, babies being born. And well, for vaginal deliveries, usually the midwives, at least at Port of Spain General Hospital, they kind of take the lead. The doctors don't really participate in vaginal deliveries unless there's like complications. They will signal for the doctors to come and take over, but for the most part, the midwives take charge of the vaginal deliveries. And it was really cool to see like the work that they do and everything, when they're encouraging the mom to push and everything, and they cheer you on, and they're really encouraging, and it was really supportive, and it was really cool to see. And we get to assist on the deliveries, and the nurses, once you are respectful and you're taking interest and stuff, they're really willing to teach you. And yeah, we get to deliver I remember there was a younger nurse. She actually coached me through delivering the placenta and everything. It was really cool. Like you kind of have to massage the uterus and kind of slowly pull at the umbilical cord, and slowly kind of pull and get. It was really cool. Like the uterus is at that point, it's firm, it's really hard, and it was just really cool. It was a really cool experience, and I enjoyed it. And then they were kind of, there was another midwife. No, I think she was a nurse. I'm not too sure if she was a midwife or a nurse, but she was definitely a senior staff there. She was kind of showing us the different parts of the placenta and what you call the different positions where the umbilical cord meets the placenta, whether it's central or towards the edge and stuff like that. And she was showing us all the different parts, and how to check to make sure that there are no pieces that remain inside the uterus and stuff. That's why, kind of helping to massage uterus is really important. It was really cool. I thought it was really cool. Again, I enjoyed my experience because I got to do stuff. I mean, the only thing I did not like was the smell of the placenta. It's really fresh. It smells bad, and I would encourage you, when you're doing that part, wear a mask because it smells really, really bad. And I felt like when I went home, I could still smell the placenta on me. That's the only thing I didn't like. The smell of placenta is not very nice. But other than that, 10 out of 10 experience. 10 out of 10. Yeah, so would I consider obstetrics and gynecology as a specialty that I could see myself doing? Like, I know that I want to do something surgical, but what I like with obstetrics and gynecology is that there is, a blend of medicine and surgery, which is really nice, and I like it. I don't think, like, dealing with pregnant women or women with any gynecological, issues and stuff, I don't find it particularly difficult, any more difficult than dealing with any other patient, to be quite honest with you. Not really. So yeah. No, I just want to share like some tips on how to survive the obstetrics and gynecology rotation. So the first thing I would say is try not to miss, especially your clinic days. I think those days are when you kind of get to assist on a lot of, the procedures that may come up in the OSCE exam, right? So case in point, the week before the exam on clinic, I actually wanted to stay home that day, but something told me, just go. And we were shadowing different doctors on the team that day, and I remember one of the interns, he kind of tapped me on my shoulder and he was like, he needed a chaperone to do an exam on one of the patients, and he asked me to chaperone him. So got in there, and then he was like, I just needed to pass a speculum on this patient, and then he turned and asked me, do you want to do it? And I was like, yeah, sure. And we got permission, got consent from the patient, and she allowed me to pass the speculum. And he coached me through the entire whole thing, and he was really great at teaching me. And we could observe and visualize the cervix, and everything went well. And then the following week for the OSCE exam, passing a speculum came for our skill. We were told we could get at least 3 stations, but when I did the exam, we got 2. But they said at least 3 stations. So one of the stations that I got was history taking, and the other one was a skill. And on the day we found out that the skill was to pass a speculum. And just the week before, that was the only time I got any kind of practice on passing a speculum. So that was the only thing that saved me, because I know for sure the history taking station didn't go so well. My number 1 tip is try not to miss too many hours at the hospital, because this being my first rotation, I was really kind of shy and scared at the thought of speaking to patients. I felt like I would say something wrong, or I would just not ask the right questions. So getting the experience helps a lot. So the more histories you take, the better. And that was, I guess, my downfall, is that I didn't put myself out there enough. For obstetrics and gynecology, the histories are very, very focused. You don't really have to do a review of systems. So you have to make sure that the questions that you do ask, gets you enough information. So you have to practice doing that. You don't just, it's not as simple as just following a tick list. You would hear a lot of doctors, kind of advise you on that, not to try to just follow a tick list in your head, but listen to the patient, and the information that they give you would kind of direct where your questions go. All right, so that is my number one tip, is to try to get as much exposure to different patients as possible so that you could kind of get a sense of what kind of questions to ask for the exam. The other thing is that, try to get there early to your various hospitals, be respectful to the nurses and stuff, because they really do control a lot of the maternity ward. So you get there early, you go to the nurses station, you get permission to borrow books and files and stuff. Make sure that you let them know that, hi, I just want to borrow this patient's file. Is that okay with you? Because they have their rounds to do as well, and they need the files to make their notes. Get there early, you familiarize yourself, look through the patient list and look for any new admits to the ward, and that could kind of help direct you on what patient you would like to do a history on. So you get there early before the doctors start their rounds. You could take a history, and after you finish rounds, you could probably present a history to the doctors and get practice that way too, because that's something that you have to do for your mini KEX, the mini clinical exam. So yeah, getting there early and looking for the new admit patients. So once you're done, well, for us at Port of Spain General, you have the obstetrics ward at the top, then you have the gynecology ward in the middle, the second floor, and then the first floor is where you have triage and the labor ward. So visit again, getting there early would allow you to visit the different wards and kind of get a sense of who the patients are. Go through the patients' files, look at the plans, and look at why they're doing this for this particular patient. Get an idea or a sense of, what is the management for a patient presenting with this pathology. Look at the drugs that they're prescribing and the amount. Why are they giving this drug? Do some, preliminary research so you kind of know how to manage a patient. So for us, we were assigned our own patients to manage and follow this patient every step of the way, from the time they were admitted to the time of delivery. So we had kind of got a sense of how patient management goes from the time they are admitted to the ward to the time that they go through the delivery, whether it's vaginal or via C-section, and then what we're looking for to say that this patient is safe to discharge. All these different things. So, having an understanding of who your patient is, why they're doing this for the patient, so when you eventually get to manage your own patient, you kind of have an idea of why they're doing what, right? Getting to induce a patient, actually give them the medication to help induce, the labor and all that kind of stuff, cool stuff that you get to do. If you kind of show up and you show interest, you get to do these kind of things. I remember one of our year fives actually got to, as we say in Trinidad, burst the bag. Actually got to, stick the thing and pop it and everything. She got to do that, and I thought that was so cool, to help, induce labor and whatnot. I was like, so cool. Yeah, so, again, if you are there and you're showing that you're interested, excuse me, I'll just take a sip of water. If you're there and you're, showing interest and stuff, they are more than willing, to teach you what you need to know. And again, this helps a lot. That kind of exposure helps you a lot for your OSCEs, especially when you get drafted with questions, because you could just lean on your experience. You don't really need to study to answer those questions. You could kind of answer it based on your experience. So be there, be present, and participate, right? So for studying for the final exam, there are two textbooks they would recommend, the Rupner-Rhines and the 10 Teachers. Those two textbooks are more or less all that you need. The textbooks, the Rupner-Rhines, I think is the name of the textbook. That one, some of the information in that textbook is a bit outdated, so you need to supplement it with more updated information. And luckily for me, the bedside teaching helped with that. But if you are on a team that not all teams are created equally. If you're on a team that may not, giving a lot of bedside teaching, is where you really need to lean into your self-directed learning, because the thing with obstetrics and gynecology is, so a lot of it is new. So you have to learn alongside your cases, and your cases do teach you a lot. So you would hear doctors say that all the time, and I found this to be very true. Learn around your cases. You get a case, learn it. Learn the whole pathophys, everything, the medications, the pharmacology. Learn around your cases. Do not underestimate the embryology. It comes back to bite you. My particular exam that I sat had a lot of embryo questions. When you thought that they were going to focus more on the anatomy, nope, they focused on development of the sexual organs. A lot of the anatomy questions were embryology. It was completely unexpected, but it came. Some exams are different. The other groups before me, their exam didn't have a lot of embryo questions. For some reason, our group got a lot of embryo questions. So every exam is different. I'm just putting that warning out there. You may get an exam where it's heavy on the embryology. So don't underestimate the development of the sexual organs, both male and female. Not just the female reproductive organs just because you're doing gynecology. I'm losing my light. Yeah, sorry guys. I'm starting to lose my light there. Yeah, so practice your counseling stations. Practice. What I would say is write out your script, and if a doctor and your team has the time and wants to listen to your script and give you some kind of critique on it, that is very important. So consider doing that. Take the time every week to write out at least one script at a time, because you would have your other responsibilities to do at the hospital, plus you have to work on your casebook. So I would say at least once for the week. And the scripts aren't long. My scripts were about 2 pages long. So the scripts that you write out for your counseling station, they're not going to be that long. So I think once a week, if you could just get one script out, how to counsel a patient and pre-pregnancy counseling a diabetic patient, counseling a patient on the different hormonal contraceptives that they're out there, or specifically they might ask you to counsel a patient on the use of the Mirena. Maybe you have to break bad news to a patient that they may have some atypical cells on their pap smear, and how you would go about counseling a patient on that. Look at how you go over the procedure for the colposcopy. Write out your scripts, just get them out, and whatever information you're missing, make your edits and so forth. But so again, I'm just giving advice that I wish that I had and I wish I knew before going into the rotation. So I hope that whatever I shared was somewhat helpful. And would I be considering obstetrics and gynecology as a specialty that I could see myself in the future? Yeah, I do. Funny enough, I do. I really did enjoy the kind of stuff that I got to learn about in the rotation. Like I mentioned before, it does have a lot of medicine, but it also balances it off with a lot of surgery. So yeah, I think obstetrics and gynecology is definitely a strong contender for one of the specialties I would consider in the distant future when I want to do my training. Yeah, I do. I really do recommend. I give it a 4.8 out of 5. 4.8 out of 5 stars for obstetrics and gynecology. I really do. I really do like this rotation. The only cons that I have seen with obstetrics and gynecology is the work-life balance. That's the only thing I would say, is that there is none. From what I observe, it is a really tough job to do. It's something that you have to really love to do it. I'm being really honest with you all. The work-life balance just is not there. Those doctors, down to the consultants, they work really long hours. They really do. And especially the interns have it hard. So just know that when you start internship, and you go through your Obs&Gyn rotation as an intern, your hours are going to be rough. It's going to be rough, right? Just putting that out there. Your hours going to be rough. And I looked at the intern and it was like, your life looks difficult. And that's the truth. So that's the only thing I would say. So I hope that this video was helpful and it kind of gave you some insight into obstetrics and gynecology. I hope that I wasn't rambling too much and you kind of got a gist of what my experience was like, and maybe it's something that you would consider. And if you want to get a better sense of how my Obs&Gyn rotation went, you can look at the vlog that I posted a couple months ago and see if it's something that you would enjoy. So thanks again for watching, and I will see you in the next video. Goodbye for now.